thank you for introduction. Today, I'm so honored to be here again at the Great Conference 2025. And I'm so happy to have a chance to share my knowledge, my experience, and also my passion about my topic today. Are you ready to dive into our topic today? Yes, here we go. The true elegance of the human body is defined not only by face, but it's also defined by the vitality of the muscle. Because the true beauty of the human body is beyond the aesthetic. Muscle is the true beauty of the human body. It's strong, vital, and essential for health because muscle is the vital organ of the human system. It's very essential for our body metabolism, metabolic health, resilience, strong, and the muscle that also involve about our survival and longevity. When we talk about muscle, everybody here thinking to the skeletal muscle mass, and as we know, skeletal muscle mass, they have many roles and many functions in our body, but they have the two crucial functions. The first one is about the structural function. For the movement, for the posture and balance, during you sitting in the conference, your skeletal muscle is still function and about the strength. And another one function, as we know, is about the metabolic and endocrine function. Metabolic and endocrine function of muscle is very important because it's like the amino acid reservoir for your body during the fasting, during you have the illness, and also like during you have the stress. And it's one of the source of products about the glutamine. Glutamine is one of the amino acids. It's very important for your gut, for your immune system. And one of the function that I love the skeletal muscle is about the myokine. Myokine is like the biosignaling molecules that's produced from the muscle, especially when you have a movement, when you have exercise. Myokine, they have many role functions in our body, from your head and to your tooth. And then let's go. During you have the movement, you have the exercise, myokine is responding to your exercise. And as we know, for some example of the myokine, everybody know here is like the BDNF, brain-derived neurotrophic factor. And many of myokine, especially that is produced from the skeletal muscle, myokines can communicate about your body, from the tooth, from your head and to your tooth, including about like the brain, bone, and core tissue, gut, and also it's control about like the function of the immune system, and also the muscle itself as well. One myokine that I think everybody should know because it's talking too much in the exercise medicine is that interleukin 6. Interleukin 6, they have many roles about the metabolism regulation because it's like the anti-inflammation myokine. It's control about like the hormonal signal in our body, blood sugar, fat burn. It's change about your fat to brown fat that make your body burn more fat. And it's very crucial for your immune because it's like an immune moderator. Okay, and then as we know, when we come to around 20 to 30, it's the peak of our muscle mass and also muscle strength. And again, then we go to, okay. And unfortunately, when you reach to 30 years old or maybe 40 years old, your muscle is declined around 3 to 8% a year. Not only for muscle mass, but also muscle power and also muscle strength. So when you reach to 60 years old, your muscle is very quickly to lower levels of muscle synthesis. And they have information around when the people they reach to 70 years, the muscle is declined around 10 to 15% per decade. So it's time to invest and focus your muscle now. And let's see the next one. When we talk about muscle strength across the lifetime, as we know, muscle strength and also muscle power is the character of the muscle that's very declined before the muscle mass. In the early life, around maybe 20 to 40 years old, the muscle strength and also muscle power is more the peaks, is maximized peak of our body, and is above the threshold of low physical performance. During adults, if you training your muscle well, you exercise regularly, you eat well, you can maintain your muscle power and also muscle strength. But some, they have like a lower muscle strength and also muscle power. And at the same time, when we go to the older adult life, let's see this one. When we go to adult life, the muscle strength and also muscle power is declined quickly. We have a term of lower muscle strength as dynapenia. And muscle power also, it's like the powerpenia. It's one of the conditions that our body have lower before the muscle mass. Okay. So, here we go. Okay. So today, I think our goal is to prevent and delay muscle loss. The aim is to maximize during you in the younger age or adulthood and maintain when you reach to adult life. And the goal of the muscle power and muscle strength, we need to minimize the loss when we go to the elderly. And what happens when we have aging? About the skeletal muscle structure and the muscle function. In this picture, they compare our normal muscle fiber in the normal adult lives. You can see the good that they have more of fiber, more of muscle fiber and low of muscle fat, together with the healthy mitochondria. And when we change to the elderly period, the thing is changed because the muscle mass is lower, fat increase, and mitochondria. In this picture, they show unhealthy mitochondria or mitochondrial dysfunction. We call this condition as sarcopenia. Sarcopenia, they come from many causes such as hormonal change, chronic inflammation, and also oxidative stress. Let's see about this picture. This picture is from the MRI of the two thighs muscle of the younger adulthood. On your right side, they show the bits of the muscle mass and a little of fat mass. When we compare to another side, it's the elderly or sarcopenic thighs muscle in sarcopenia. They have the low of muscle mass, fragmented muscle, and also fat that increase replaced by the muscle area. Together with the connective tissue, this picture is clearly showing you that when you train muscle well, you can prevent about the muscle loss and also muscle fragmentation. And what sarcopenia? Sarcopenia, they have definition from the Asian Work Group of sarcopenia and updated in 2019. They define as sarcopenia as the related loss of muscle mass and also muscle strength and of low physical performance. When you thinking about sarcopenia to your kid or your patient, we need to screening with a simple tool or simple questionnaire. And if you want to confirm, right now they have criteria to confirm. Start with the muscle strength and muscle mass first, and then we can test about like the muscle performance. And in this picture, They show about 3 types of the older adults. I think every year you have a goal to be a healthy older adult, right? Because successful aging. In the healthy older adult, they can move very well, they have active lifestyle, and they have independence because they can preserve the muscle and also strength. But in sarcopenic patient or the people, they have minimized a lot of muscle mass and also muscle strength and replaced by some of the fat mass. If you see the posture, their posture is like a stoop posture. It's like the imbalance of like the spine. And one thing that today I need to focus is about the sarcopenic obese older adults because they have more body fat, increase the fat mass, and lower about the muscle mass. Sarcopenic obese older adults, they're not same as sarcopenia or not same as obesity alone because they are double threats, they are double risk of our health and our body. And let's review again. When you have more aging, it's very easy to gain fat, right? And about the muscle mass is maybe tend to lower. In this picture, you can see about like the normal muscle fiber. Our muscle fiber have 3 types, type 1, type 2A, and type 2X. For normal muscle chain, when we have more aging, type 2 is like the muscle fiber that it can increase the size when you go to gym, you do weight training, you do resistance exercise. You increase the muscle type 2. But muscle type 1 is very important too because it's linked with your endurance. You can do everything well and not fatigue. Easier. This picture is shows sarcopenic older adult, they have low of muscle mass when they have aging, but fat is not increased. But situation changes when we have more fat inside. Not only you have older age, but right now, I recommend I cheer up everybody to check yourself if you have excess body fat. Excess body fat it infiltrates to your muscle, and the action is doing more than the volume or the fat mass because it makes your muscle change about microcirculation, increase chronic inflammation, mitochondrial dysfunction in the muscle, and your muscle is very difficult to build or lower about protein, like the muscle protein synthesis. We call anabolic resistance. This is very important in the people who are living with obesity. And what is we know about this one? The obesity is lead to significant alteration in skeletal muscle beyond its change in size and volume because it change about quality of muscle. Our keyword today, obesity change quality of the muscle. And okay. And this picture is so that when we have more aging, our body needs more like energy burden. And it change about like inside the muscle, especially for the mitochondrial dysfunction, increased oxidative stress, and it's linked with the chain of like the myocytes or the muscle cell and satellite cell. Everything happens, then it makes our body have more risk to fatigue, to weakness, and difficult to movement. And what is the definition of sarcopenic obesity? In 2022, ESPEN and also EASO, they have consensus and they define sarcopenic obesity as like the coexistence of the low muscle mass together with excess body fat and it affects the muscle strength and our muscle performance. When you have sarcopenia together with obesity, then it becomes sarcopenic obesity. This diagram shows 4 types of the phenotype of the people. Healthy weight, sarcopenia, obesity, and also sarcopenic obesity. Sarcopenic obesity is contributes to many of risk factors in our body, chronic disease, and many things. The question is why sarcopenic obesity is more dangerous than sarcopenia. The question is, sarcopenic obesity is increased more than risk in upper body, is increased the risk of cardiovascular disease, diabetes, risk of cancer, failure, fracture, and its effect to many quality of life. So we need to screening, we need to focus on your care to look for the excess body fat. Even we have normal BMI, as we know, obesity right now, they changed the new definition. The BMI is just screening. The definition of obesity right now, we need to check about the excess of body fat. So body composition is very crucial. And this summary, this paper, they answer the question about the mortality risk of sarcopenia. Is just they define as hazard ratio. It's around 1.3 to 1.9, but sarcopenic obesity, the hazard ratio is double. It's go to 2.5, and it's affect to many of the health problems, as we know in this picture. How about pathophysiology of sarcopenic obesity? Excess aging, hormonal change, when you have low of sex hormone, testosterone, estrogen, in menopause, in andropause, and when you have more stress, high cortisol, it makes your muscle more catabolic state. Change of the mitochondria, such as mitochondrial dysfunction, chronic inflammation, ineffective autophagy, and it's change about the adipokine. Adipokine is one of the biosignaling molecules that produce from the muscle mass. And lower of the myocyte or myokine or exokine, as I mentioned before. So what is the common cause? As we know, aging, unhealthy diet, and lack of exercise or sedentary lifestyle is a common cause that contribute to obesity, contribute to increased body fat in upper body, and together with lower of muscle mass. So sarcopenic obesity, they have many causes, but insulin resistance, chronic inflammation, and also aging is the main cause. When we have increased body fat, when we look to the molecules of adipocyte is not increase the number, but it increase the size. We call hypertrophy, not hyperplasia, right? In adipocyte, if it's expanding about the size, they have dysfunction. They cannot working well, so they produce about anti-inflammation. They're recruiting about immune cell, especially macrophage. The macrophage, they produce more pro-inflammatory cytokines. So increased inflammation is made our body, especially for skeletal muscle. They have insulin resistance, and also insulin resistance is make your muscle difficult to maintain about the size, strength, and also power. So it brings to sarcopenic obesity. One situation I think everybody here may be fine in your case. Someone who lose weight by maybe inappropriate method, right? Very strict diet, no exercise, or do fasting for a long time, and not adequate exercise. They lose weight, and after that, they regain the weight. One cycle of the weight loss and weight regain, we call recycling. They have information, they have the trial or the study that if you lose weight and regain the weight on one weight cycling more than 5 times, you can develop to sarcopenia more than 50%. So please remember, every time of weight loss, it should be a quality weight loss. It should not lose muscle, or should preserve muscle first. And minimal muscle loss, okay, we accept for this one, but it should be about fat loss is a measure. By comparison with non-pharmacological calorie restriction or diet control, they have the role about the fat-free mass loss or lean mass loss around 10 to 30%. And how about the medication? Right now is the era of GLP-1 receptor agonist, right? Everybody here know about this medication. It's communicated to lose weight quickly, easier, but they need to focus on the adequate nutrition and also exercise, especially resistant exercise. They have many trials right now there. They show about the muscle loss and also fat loss and trend of the GLP-1 medication right now. They need to preserve the muscle and also they need to build up more muscle. I will talk later about the novel the treatment. Around 25 to 39% of fat female loss in the GLP-1 treatment in the period 36 to 72 weeks is found in the trial. And the summary of the plan. If you plan to make about weight management or obesity management for your case, we choose avoid the suboptimal treatment plan by restrict more diet. Please make like the optimal nutritional plan, because when we have like when we do more strict program and not enough for training program, your case will be have a risk of sarcopenic obesity in the future because they lose the muscle, and if they cannot eating well and maintain their program in the future, sarcopenia together with aging is can occur. So we call poor metabolic health. This is the key in this program. Our goal to preserve or maintain or increase the muscle mass together with low body fat is the key by the optimized nutritional program, regular exercise, and together with the medication or supplement as we can need. And how about the diagnosis of sarcopenic obesity? At a summary for the ESPN and EASO consensus 2022, they have 3 steps. Step 1, screening is very easy. Who is the high risk case? Obesity or sarcopenia from clinical setting, from questionnaire, and you can use the simple tools such as BMI of the circumference. Diagnosis is step 2. Diagnosis for sarcopenia and also obesity. And the last one, staging. Staging is very simple for HO or sarcopenic obesity because they have only 2 steps. 2 steps. Step 1, no complication, and step 2, they have complication contributes that attribute to sarcopenic obesity. Okay, let's deep inside for the screening. Okay, for the screening case, I usually recommend you to screen with the BMI first, especially based on Asian cut-off point, right? BMI more than 25, greater or equal to 25 kilogram per square. And I usually recommend check together with waist circumference because some people sometimes they have higher BMI, they have more muscle, right? But waist circumference is very important. If you have waist circumference for men more than 90 centimeters, and for female more than 80, you have the risk of abdominal obesity. And one thing, calf circumference is very common to sorry. Sorry about my slide. Okay. Waist circumference, they have another one of the criteria that we can use. We can do to screening, and then we go to diagnosis. Diagnosis is very simple. Step 1, diagnosis for obesity. You can do the fat, such as the percent body fat or visceral fat mass together with the BMI. And about the muscle strength, we start with the muscle strength first. Hand grip dynamometer is one of the 2 that we can apply to our clinical setting. And then we can test about the physical performance by the gauge speed of 5 times 6 to stand test. It's very easy. You can do by yourself. If you do 5 times, if you take time more than 12 seconds, you have low physical performance. You can try this one. And another one about the body mass, muscle mass, we can do the body composition analysis because they have the criteria. The criteria we need to check about the skeletal muscle in the body composition analysis. DEXA scan, dual energy X-ray absorptiometry, is the gold standard of body composition analysis. But in our setting, we can use the BIA, bio electrical impedance analysis, because it's very easy to and simple to use. This one is provide about the fat mass, fat free mass, percent body fat, and also visceral fat area. When you do this one, you get this information from the body composition analysis. But for me, I recommend you to focus on the sum of skeletal muscle in the upper limb and lower limb, not include the core muscle, right? This parameter we call appendicular second skeletal muscle, and you can divide by the height in mass square. You can get the new index. The name is ASMI. In the criteria diagnosis for low muscle mass, they use the ASMI. If you use BIA technique, the number less than 7 for male and less than 5.7 for female is classified as low muscle mass. And in Germany also, they developed to the guideline to screening and diagnosis for sarcopenic obesity. The interesting of this guideline, they use the visceral fat area more than 100 centimeters square. It's very easy. You can see from the body composition analysis. If you have the fat inside or the visceral fat more than 100, it's classified as you have the abdominal obesity. And we go to the last step, staging. Step 1, sarcopenic obesity, no complication. And step 2 is without at least one disease. It may be metabolic disease, cardiovascular disease, diabetes, heart disease, and also it includes about like the physical disability or clinical obesity at this one. And here we go to the last step, how to prevent and treatment the sarcopenic obesity. We have the 4 pillars. The first one is about the nutrition, focus on the right nutrition, especially for protein. We need to include the high protein together with the high nutrient diet. And don't forget to the structural exercise. Again, structural exercise, because they need to do regularly, at least 3 to 4 times a week. I recommend to do for like endurance exercise in the first month, and then we can apply resistance exercise with the weight training, maybe supervised by the personal trainer, and it's easy to start. And healthy lifestyle, sleep, stress management, medication, and supplement is very important. How about healthy diet? Healthy diet in the management of obesity and sarcopenia, the key is protein. You should increase protein around 1.2 to 1.5 gram of protein per kilo of fat-free mass or ideal body weight. Not the actual body weight of your case if they have higher body weight, right? Because this weight is include the body fat also. So we need to use the real, like the fat-free mass is more accurate. But if you don't know about fat-free mass, you can calculate for ideal body weight. Regular exercise, as I mentioned, and the normal treatment in the future, we can use like the supplement, vitamin D, calcium, hormone replacement therapy, testosterone, and maybe some case they need some medication, they need some like the weight loss surgery, and the medicine in the future that I mentioned is about the myostatin inhibitor or activin type 2 inhibitor. Don't forget to combination about the exercise and use about the optimal nutrition for your kid. We can apply whey protein, we can apply like the amino acids, especially for HMB, it prevents muscle breakdown and it promotes muscle growth. And the final this is the summary management of sarcopenic obesity. Nutrition is very important. As we know, protein, high quality diet, and together with the exercise program, aerobic exercise, weight training, and the exercise that your patient they have preferred. Medication, GLP-1, also GIP, dual agonist is the role in the future. We can use in some case with indication, and novel treatment in the future such as myostatin inhibitor or bimagrumab. It's like the activin type 2 inhibitor. It prevents about muscle breakdown. But right now they are in phase 2 study. I think in the near future you will see about the medication that can lose weight together with preserve muscle and increase muscle as well. So we need to look forward for this one. Some or maybe like the hormone therapy is like the novel in the future. Some case they need bariatric surgery. What is the goal? To lower fat, preserve, increase the muscle mass, and lower inflammation, lower fat in the muscle, increase about the physical function and quality of your patient. Okay, so I recommend everybody to invest in your muscle today with strength, good health, and longevity tomorrow together. Thank you.
Presentation. So now we are moving to the very special part of our program.